50 participants. Good afternoon, everyone. I'm Dr. Emily Sinai. I'm an assistant professor in the Department of Environmental Medicine and Public Health here at Mount Sinai. I'm going to be your moderator today. It's my pleasure to welcome everyone to today's lunchtime chat in the Mount Sinai Institute for Exposomic Research, Environment and Health series. This is the second of lunchtime lectures that will go through June 2nd. Next week, we do not have one, but there will be plenty coming up in the future weeks. This series is designed to be a forum to connect you with the scientists who are studying the health impacts of complex environmental exposures. Our team at the Institute aims to really translate the science for individuals and communities to empower them to make their own health-centered choices, as well as to give them tools to advocate in their communities for protective policies. Now, today's presentation is going to be about 25 minutes long. We'll have 20 minutes for Q&A. Please feel free to put questions into the Q&A throughout. We'll be curating those at the end, but we hope to get to as many as we can. So let's get started. It's my pleasure to introduce Dr. Homero Harari. Dr. Harari is an assistant professor in the Department of Environmental Medicine and Public Health and an industrial hygienist at the Selikoff Centers for Occupational Health. Those are both here at Mount Sinai. He studies the exposure to workplace and environmental hazards and their impact in human health. He is a principal investigator of the just released Safe and Just Cleaners study, a project to help understand exposure to cleaning chemicals and disinfectants in Latinx domestic workers. So Homero, I'll let you take it away. Are you good? Just unmute.
There, thank you. Thank you, Emily. Thank you very much for the invite. Before I start, I would like to thank the Institute for Exposomic Research. Also would like to thank all other institutions that are supporting this series, the PSU, the Mount Sinai Environmental Health Sciences Core Center, the New York State Children's Environmental Health Centers, and the NCAS Clinical and Translational Sciences Award Program, Translational Science Hub. I also have the pleasure to invite you to our next talk. It will be not next week, but the following week on Wednesday, April 7th. We'll have Professor Shanna Swan, who will be talking about her research on male and female reproductive health. And we'll be also sharing more about her latest book, Countdown. So I would like to start by just introducing this topic and talking a little bit about cleaning products and health effects and what is known. In 2014, a systematic review of EPI studies found that cleaning products and various jobs and tasks are associated with increased risk of asthma and rhinitis in cleaning workers. And they also highlight that from their review, the interventions have been inadequate, especially in domestic cleaners, because of lower or no worker education, the lack of awareness regarding risks, the lack of protective clothing or personal protective equipment, and also the lack of surveillance data. Last year, there was a new systematic review and meta-analysis that also found that cleaners have an increased risk of developing asthma, but also chronic obstructive pulmonary disease. And the authors highlight that there's a need for more enhanced exposure control and respiratory health surveillance, but also highlight the lack of quantitative exposure assessment to cleaning products. In 2008, Sveins and their colleagues found that women who perform cleaning tasks suffer accelerated lung function decline, which is comparable to smoking somewhat less than 20 pack years. And in a subsequent commentary by our colleagues at NIOSH, they found that effective engineering and administrative controls require the knowledge of exposure levels and the specific tasks, tools, and workplace or home characteristics leading to exposures. Therefore, there's a lot of need to understand exposure in cleaning tasks in order to think about how to intervene. So because of these research gaps, our work in our occupational health clinic, seeing many cleaners who have developed respiratory problems. A few 3 years ago, we got funded for this project that we have called Safe and Just Cleaners, reducing exposure to toxic cleaning chemical products among low-wage Latinx immigrant domestic cleaners. This is a community-based participatory research project between Make the Road in New York, which is the largest Latinx community organization in New York City with over 30,000 Latinx members. The City University of New York, Queens College, our colleagues at the Barry Commoner Center for Environmental Health, and at Mount Sinai, we're representing the Institute for Exposomic Research and the Selikov Centers for Occupational Health. So why did we decide to focus on domestic cleaners? So in New York State, it's estimated that there are between 120 and 240,000 domestic cleaners. The median wage is less than $21,000 per year. Around 50% of them are Latina and immigrant, and they are independent contractors. Therefore, they are not covered by any health and safety regulation and by OSHA. So there are many major research gaps, but I want to just share with you the research questions of our project. They are which cleaning products and practices are most common and lead to hazardous exposures? Also, how do cleaners' knowledge and attitudes act as barriers or facilitators of interventions? And which actions by worker, community organizations, and others will reduce exposures? So as part of the project, we aim at developing a survey among Latinx domestic cleaners. We aim at collecting data from 400 Spanish-speaking domestic cleaners. And in the survey, we were looking at gathering information regarding employment and working conditions, self-reported health, knowledge and attitudes, and the types and the use of cleaning products and disinfectants. So in order to develop the survey, and given that it is extremely relevant for us to know what products are used and how these products, what products are used and how these products are used, we developed this and organized these focus groups. And when I say we, I want to highlight all the work that our colleagues at Make the Road New York and at the Barry Commoner Center for Environmental Health, all the amazing work they do with the community. So we organized these focus groups. And here we're showing you how we collected initial information, trying to understand what products are used and how these products are being used. So in the picture, we're showing you the four areas where domestic cleaners reported to clean the most when they are hired by clients. We have bathroom, the kitchen, the living room, and the bedroom. We asked them we created stickers with the different labels of different cleaning products that we were told were the most common to be used. And as you can see in each quadrant here in the bathroom and in the kitchen, cleaners place the stickers indicating what products they use. They also added a sticker suggesting what kind of personal protective equipment they use, in this case gloves, but also they will highlight which areas they consider they use most of the cleaning products and how these cleaning products are the most hazardous. And that's indicated by the red, yellow, and green color stickers. We also gathered information in terms of how and what is the order of cleaning, trying to understand not only the products and the impact to them as cleaners, but also how this can impact indoor quality. Furthermore, in our focus groups, trying to identify the areas that are clean, we In the bathroom, we ask cleaners to list all the areas that they clean. And in addition, to highlight with a red, meaning a hazardous task, or a green, not hazardous task, and cleaning products, to highlight which products they use the most and how they consider the areas to be the most, that they clean the most and they are the most hazardous. In this case, I start with the tiles and ceramic, the toilet, the floors, the windows. So from this exercise with different, in different focus groups, we selected two main areas in the homes that are that use most of the cleaning products, and these are the bathroom and the kitchen. And we also identified the areas within the bathroom and the kitchen that are cleaned the most, and I'm listing them here. In the bathroom is the toilet, the tap, the shower, the sink, the floor, and the window. And in the kitchen, the refrigerator, the stove, the oven, countertops, and floors. This information was crucial for our work, as we're trying to understand how these different areas are being cleaned, with which protections, with what brushes, and in which ways. So all this information helped develop the survey. Now, as I mentioned before, our survey was also aimed at understanding different employment and working conditions and self-reported health effects. We have completed the analysis of the employment and working conditions, and today I will be sharing those results with you. So the survey results, we conducted outreach and recruitment in 4 boroughs in New York City and Westchester, and they are highlighted here in the map to the right. We collected a total of 402 surveys, and our eligibility criteria was to recruit domestic cleaners who have 6 months of experience as a domestic cleaner and worked as a cleaner within the past 2 months, and cleaners who worked at least once a week. We achieved a participation rate higher than 70%. Again, thanks to the great work that our colleagues that Make the Road did in recruiting and doing outreach for our study. These are some of the results. The average age of the cleaners was 45 years old, with a range between 21 and 78. 42% were mestiza, and 19% Black, and 12% white. 99% were women, and 99% of them spoke English at home. Their English comfort level, 38% felt uncomfortable speaking English, 47% more or less comfortable, and only 15% reported to feel comfortable. Their education level, 31% had elementary school and 43% high school diploma. 100% of the household cleaners that we surveyed are immigrant, and the countries of birth of the domestic cleaners that we interview are 44% from Mexico, 19% from Ecuador, 10% from Colombia, and 10% from Guatemala, Dominican Republic, and Peru. Employment questions. First, we wanted to understand their work experience. We found that 35% work for less than 5 years as cleaners, and then over 60% of them work for more than 5 years as domestic cleaners. 76% of them reported to be self-employed, and that means that they work alone. Only 10% are self-employed and work with another cleaner, and only 17% employed by a cleaning agency. As an average, domestic cleaners work 22 hours per week and have an average of 3 different clients. Their wages, they have an average of $15 per hour as an average, and that's average by hour or by job. 49% of the cleaners that we surveyed reported have experienced wage theft, even being paid below the minimum wage at some point. 93% of them had no formal written contract, and the vast majority of them have only a verbal agreement. 60% of them have a verbal agreement. 25% of the cleaners that we surveyed report that their lunch breaks were denied when they were working more than 6 hours cleaning a specific home. In terms of income, we divided the responses from our cleaners in primary household wage earners and non-primary household wage earners. 44% reported to be the primary wage earners, and from them, 81% report to be income below $1,500 per month, $1,500 per month, which is below the federal poverty level from 2020. From the non-primary household wage earners, they also report, the majority of them report to have income below $1,500 per month. In terms of income insecurity for the primary household wage earners, we find that 24% report to have insufficient income to cover basic expenses, and 54% reported to cover expenses, but it was difficult to get by. More than 50% reported to be worried to not having enough clients in any given month. In terms of self-reported health, we asked cleaners, and they reported 30% reported their health as poor or bad, and that compared to the 22% that is being recorded across New York City adults in general, and 20% versus 20% of all the adults between ages of 45 and 65 in the US overall. Strikingly, 49% of the cleaners do not have any health insurance or health protection, therefore they cannot be seen by any doctor. And this compares to 20% of New York City residents who do not have insurance, and versus 8% in the overall in the United States. Regarding to paid sick leave, 85% of cleaners did not receive any paid sick leave. 46% of them felt that they couldn't take any sick leave without reprisal. And we found that 1/3 of the cleaners went to work even though they were sick because they fear about losing their jobs. In terms of self-reported health, we found that 4% of the cleaners reported to currently have asthma. And that in regarding to high skin and eye irritation, 27% of the workers complained of skin rashes that improved when they were away from work, when they were not cleaning. That's 3 times higher their rate from a similar survey. And 74% of the cleaners complained of eye irritation while working. 30% said that the eye irritation was strong enough that they needed to leave the room when they were cleaning. Regarding to musculoskeletal disorders, 62% reported to have pain during the last 3 months, and 44% reported as the back as the main place of injury. 61% of the cleaners reported to working on their knees while cleaning either the bathroom or the kitchen. In terms of cleaning products, in order to analyze these data, we use well. I will just explain first what we found. At first is that the cleaners have very little saying regarding the products that they use when cleaning. So 68% of the cleaners reported that the client decides which products will be used during a cleaning job. They reported that 80% of the cleaners reported that 80% of the cleaners, I'm sorry, reported that the labels, that they could read the labels. However, they were really hard to read and to understand. 98% of our cleaners in a study agreed that cleaning products can have negative health effects on health, and that 52% reported that it was necessary for them to use strong chemical products for doing their job. Now, we gather all the information regarding to the cleaning products that they use, and we reviewed safety data sheets and identified the main active ingredients. We also use EPA list N to look at the main active ingredient of different products. And from the 12 areas, 6 in the kitchen and 6 in the bathroom, we found that at least 50% of the bathroom tasks involve the use of a product contains quaternary ammonium compounds, an active ingredient for a disinfectant, and 51% reported in the bathroom at least the use of one product containing sodium hypochlorite or bleach. And we found that either in the bathroom, in the kitchen, 60% of the products contain quaternary ammonium compounds and 54% bleach. Most importantly, 40% of our cleaners reported to mix products when they are cleaning the bathroom or the kitchen, and of them, 80% reported mixing the products because it will help them to do their job quickly. So basically, 50% of our cleaners reported to using products with quaternary ammonium compounds or bleach, which are known to cause respiratory health problems and also thermal problems. For the first part of our survey was recently published. It was published last week. We produced this report, The Toll of Household Cleaning Work. The report is available online. This is the link. We will send after this talk, we will send a link so you can access the report and look at the rest of the information that was collected in our survey. So the information from our survey is very important for us to understand the working conditions, the employment, but also understand the products that they are being used and what are the exposure levels to different cleaning, different chemical ingredients in these cleaning products. As part of our project, we plan to use this information to identify the tasks and the products most commonly performed and conduct exposure assessment to measure inhalation and thermal exposures. However, while thinking about the study, we also wanted to understand what is the availability and the use of cleaning products and disinfectants in Latinx neighborhoods. And with that information, we're hoping to gather more information regarding which products are Latinx domestic cleaners exposed to. So we conducted this study in addition because we know that 75% of the cleaners that we interview reported to buying their products in neighborhood supermarkets or 99-cent stores. Our quantitative exposure assessment is being delayed because of COVID and the pandemic. So we hope to resume the work this year and have the results from that analysis. But I'm going to share with you today what people report, what our cleaners and stores what are the products that are available in stores in Hispanic dense neighborhoods in New York City. So first of all, we identified Latinx neighborhoods in New York City. We identified nine neighborhoods, 2 in the Bronx, 2 in Brooklyn, 2 in Manhattan, 2 in Queens, and 1 in Staten Island. We use New York City planning geographic information systems to determine the percent of Hispanic population in each neighborhood. Also, we use an inventory of different stores across New York City, and we targeted the commercial stores like bodegas, pharmacies, 99-cent stores, and supermarkets in these Latinx neighborhoods. And then doing random sampling, we collected information inside the stores to identify which products are for sale and are available for Latinx residents. So cleaning products and the chemical composition. So this is how we collected the information. We went to a commercial store. We looked at the shelves, created an inventory. From this inventory, we collected product name, manufacturer, the volume, the scent or the fragrance, and the price of the product. For all the cleaning products and disinfectants, we reviewed the safety data sheet and extracted the chemical composition that was reported in their ingredients section. In this first analysis, we categorized products as containing bleach, volatile organic ingredients, and quaternary ammonium compounds, and then other. So in total, we visited 94 stores with a total inventory of over 7,000 products. Out of these 7,000 products, there were 809 unique products. And out of all these products, 23 were the most common and unique. And these 23 products represented 32% of the inventory. This is remarkable because when doing inventories from commercial products, we have found thousands of cleaning products. However, we were able to narrow down what are the most common products that are available in Latinx neighborhoods, and the majority of them are just 23. Looking at the ingredients, we found that there were 3% of all the products that didn't have a safety data sheet. 5% of the products didn't disclose or reported that the ingredients used in the cleaning chemical the ingredients used in the cleaning chemical are not hazardous. Only 4% were powder cleaners. And we found that 26% of all the products available contain quaternary ammonium compounds or a mix of them. Bleach is traditionally, or sodium hypochlorite has been traditionally used, so it's 22% of all of them. But we want to highlight that 26% of the products that are available in Latinx neighborhoods contain quaternary ammonium compounds, which again are known to cause respiratory problems. When looking at the chemical composition of these products across different boroughs, we find that there is no difference, and that the amount of products containing toxic ingredients remain the same across different boroughs. And finally, we looked at the specific scent. We created a new category, and we looked at the scent of all the products that we found in neighborhoods, and we found that 82% of the products contain a scent or a fragrance. This is really important for all the research that we do in, regarding occupational exposomics, because currently in the US, fragrances are not regulated, and we find that fragrances are present in the majority of the cleaning products that we have identified, either in our survey or in the neighborhoods. This project has a strong community involvement because it's a CBPR project. So we owe a lot to the community, and we have spent a lot of time working with them and trying to address all their needs and their questions. We wish we could have done more, but we have done a couple of activities. One, we developed a clinic-specific health and safety train-the-trainer program. We work with cleaners. We develop a curriculum, and then we trained over 30 domestic cleaners who would be training other domestic cleaners on how to protect themselves from cleaning products and disinfectants. And 2-3 weeks ago, we released also a series of 6 educational videos which are featuring domestic cleaners, and I'm showing you some of the screenshots of the videos that are now posted in YouTube. The series called Limpiando en tiempo del coronavirus. It's cleaning in coronavirus time. The videos are in Spanish, but they have subtitles in English, and they're featuring cleaners and that have participated in our activities and that are very eager and excited to share the knowledge with other domestic cleaners. The videos are available in this link. I will make sure that we share them in an email after this presentation. I think that my time is my time is up. I just would like to thank our colleagues at Make the Road, Daisy Flores, Jamie San Andres, Javier Gallardo, Ana Gonzalez, Angeles Solis, and Zulema Rodriguez. They do a lot of the work in the field with us. We are extremely grateful for their commitment and their hard work. Of course, I want to also thank our colleagues at CUNY Queens College, Dr. Sherry Barron, my co-PI, along with Dr. Isabel Cuervo, Gladys Palaguachi, Jasmine Oliveira, Laura Liz Olivo, Gerald Mastroianni. I want to share the principal investigator for Make the Road, Daisy Flores, as well. I want to thank our team here at Mount Sinai, Maria Baldwin, Dr. Gary Winkle, consultants, Margaret Quinn, and Charlotte Brody, and our partners, NICOSH, the National Domestic Worker Alliance, the Blue Green Alliance, and of course, I want to thank NIHS for the funding and for supporting our work. Thank you very much.
Thank you, Dr. Harari. Thank you very much. Okay, we're going to get to questions in just a minute. If you do have questions, please put them into the Q&A. We will get to them. But before we get there, I want to give everyone who joined us here today a couple options on how to get involved and get more information. First of all, one of the things that could be very valuable is if you spread the word yourself on social media, amplify our message to your networks as widely as possible. There is some options here you can see on the screen that you can use to do that. Now, if you also have any concerns in your own community, from questions about pesticide use in public parks, access to healthy foods or clean water, our scientists are definitely available to speak with you, as well as provide data that can help underpin sound policy or advocacy that you want to promote in your own neighborhood to create a healthy environment. So please, again, don't hesitate to contact us at exposome@mssm.edu. And then also, and this is pretty exciting, we are going to be creating a new board to power this pioneering work at the Mount Sinai Institute for Exposomic Research, and we are looking for board nominations. We're looking for people who are philanthropically motivated to enact change and help us advance a strategic plan. Additionally, we are also forming the Children's Environmental Health Community for those who want to help, be supportive, learn something more, and transmit that out to their community, but might not be ready to participate at a board level. And if any of these things are interesting to you, please do contact us at exposome@mssm.edu. I think we're ready to go to questions. So let's see, let me get to the questions. Okay, Homero, are there, you mentioned the quaternary compounds, ammonia compounds. What is wrong with those? And are there specific, is that something that we should be avoiding? Should we be avoiding bleach? What's your overall take on those chemicals?
Yes, thank you, Emily. Yes, so quaternary ammonium compounds have been linked to the development of asthma, as well as allergic and irritant dermatitis. So definitely there is a lot of concern about having those products and using them in our homes, or have them used by domestic cleaners. So yes, we'll prefer that those products will not be available. However, list 10, and because of COVID, EPA has formulated a list of different disinfectants that they suggest the population can use in order to eliminate COVID from surfaces. And over 80% of the products, don't quote me on that, but it's a big number, over 80% of the products, I think that in the analysis that we did of the list in April or May, 80% of the products contain quaternary ammonium compounds, and they were also for residential use. So we are concerned about the extensive use of these products and the potential exposure at home, and of course in the cleaners and in domestic cleaners, and specifically Latinx domestic cleaners that we work with.
Are they necessary to clean or disinfect or sanitize? What's the difference between those three things? And how would you approach it if you were out yourself putting together what you might use in your own home?
Yeah, thank you. That's an interesting question. I think that so we're well, the products that we use in our homes, I mean, because of COVID, there was this increased need to disinfect surfaces because we didn't know the forms of transmission. We were using all these products. I think that now, because we understand more about the mode of transmission, and I think that we could do better in terms of the products that we use. I think that if we want to use certain products, I think that we have to think not only about the product, but how to protect ourselves, including improving our work practices, including ventilation, using gloves or any personal protective equipment. So I think that is a combination of strategies that we need to use in order to be better protected, in addition to using other products. However, I'm not in a position to suggest which products should be used, and I think that that's our project. That's not the scope of our project. Although I wish I could have, I would have the secret recipe to have the best cleaner that is non-toxic to be used at home.
Okay. Some of the questions coming in about possible interventions, or did you do any interventions in the study, and do you have plans for that?
We will. Right now, because of COVID, because of the pandemic, we couldn't do all the exposure assessment that we wanted for our study. We're studying, we plan to resume the exposure assessment component of our study this year and the beginning of next year. And then, of course, understanding what are the exposure levels, we have to think about interventions. So yes, we hope that we can test as part of our study some interventions that can help cleaners and consumers in general protect themselves better.
Now, do these quaternary compounds accumulate? Is this something that if one home is cleaned, it could be a problem for someone close by or in another nearby apartment?
From what we understand about quaternary ammonium compounds, and because there are several types of quaternary ammonium compounds, we do not think that they accumulate. We do think that is a concern when they remain dry. They accumulate in the surface, and they stay inert on the surface, and therefore during the contact time, that's what a manufacturer recommends. That's when the disinfectant is more effective. We're not aware of biological monitoring methods that have been used to measure either biomarkers of exposure or biomarkers of effect. So I'm not certain about the accumulation of quaternary ammonium compounds in the body.
Okay, now a lot of these working arrangements were informal in this study. Is there a way to help domestic cleaners advocate for safer practices? And are there any resources for employers so that they can also understand safer cleaning practices? Do you have anything we can provide?
Yes. So I think I think that with domestic cleaners, consumers and clients play a big role, right? We want to educate people who hire domestic cleaners. We want to share with them the information about how toxic some of these products can be, so they make better choices in terms of buying these products and also suggesting these products to be used by cleaners. I think that that's essential. So consumer education is key. As I mentioned before, we have developed training material for domestic cleaners, so they know which products to avoid, if possible, and how they can protect themselves, as well as the importance of ventilation and different types of personal protective equipment. Yeah, I think that we need domestic cleaners and consumers to work together in order to protect both domestic cleaners when they are cleaning, but also the indoor quality of consumers who have their house cleaned.
Now, you mentioned respiratory issues. Are there any chronic health effects that have been linked with these cleaning agents?
Yeah, asthma, as I mentioned at the beginning of my presentation, asthma has been the use of cleaning chemicals and disinfectants has been linked to an increased risk of developing asthma, as well as rhinitis and COPD. However, the question remains, which products are being used and how these products are causing asthma. And that's what our project is basically hoping to shed some light as to what products are being used and what are the exposure levels. So then we can think about interventions. So that's we hope to contribute in that way to the literature, as well as to have some suggestions so consumers and cleaners can clean in a more in a safer way.
In terms of personal protective equipment, is there anything besides the gloves, which you showed some of them were using? Is there any other types of things that anybody who's using these products, if they can't avoid them, for instance, because this is their work site, would be appropriate?
Yeah, so we had I think that we believe in a strategy that includes several factors. One is personal protective equipment, and if I think that skin needs to be protected, so gloves are recommended. But that's not necessary. That's not the only recommendation that we will make. As a respirator will not be the only recommendation we will make. I think that we need to understand more work practices and how these work practices can be changed in order to see which work practices lead to higher exposures. So we can think about work practices that lead to less exposures, and also think about ventilation and engineering controls. As well as education. So I think that there are many strategies. I don't think that is just one strategy that should be used. So that there are several strategies that need to be used in order to protect our health.
Now, so one of the questions coming in says that the children are more vulnerable. We know that's generally true. Is it recommended that these types of chemicals be avoided, quaternary chemicals be avoided where children are, even in schools, for instance?
I would say yes. I would say yes. And if yes, I think that we know enough, and I think that if we can use alternatives, I think that would be preferred. Of course, we also need to make sure that the alternative that we are introducing is safer than the quaternary ammonium compounds. But I think that should be avoided.
Now, I'm not asking for a brand here, but are there particular types of gloves that you think are more effective? Obviously, we have, the medical gloves we all use. We have the kitchen rubber gloves. Is there one you would recommend? Not a brand, just a type.
Right. So we are actually doing some research about it. We develop a permission panel to see which type of glove would be the most protective. So that work is ongoing. I can just share that I use rubber gloves, the black rubber gloves that we find in the stores. But we don't have. We're doing some work around that, so we hope to share that information as soon as it becomes available.
Okay. I think we have time for maybe one or two more questions. From this experience, was there any broad things that you learned from the study that might be applicable broadly? You learned a lot about what's out there in products that are out there, what they're using. Is there any big take-home messages that we could all learn from?
Yeah. So if we understand, so we mentioned that. Well, I think that there's a very important piece here in terms of the working conditions and the livelihood of domestic cleaners, right? I think that that we want to highlight that they have precarious jobs and they are exposed to toxic chemicals. I think that for us, and in order to think about their health, that's a population that needs attention. We need to think about how to protect them, how to include them in health and safety regulations that can cover contractors. I think that that's important. Another important aspect is that we know that 50% of them do not have health insurance. I think that that's something that we need to do. From what we have learned, we know that the products that they use are mostly recommended by the clients, and up to 60% of the products that they use contain quaternary ammonium compounds, and 51% contain bleach. So these are products that are commonly used in homes. So I think that we have to do better in terms of what we recommend and what is available out there for consumers, given that we know the health effects of the chemical ingredients of these cleaning products and disinfectants.
Listen, I apologize. We are out of time. We have so many questions that went unanswered, but please join us for our upcoming chats. Thank you so much, Dr. Harari. And again, I apologize we could not get to all the great questions that are in the chat, but do get in touch with us if you'd like some more information, and we hope to see you in our upcoming lunchtime chats.
Thank you.
Thank you everyone for coming. Thank you, Homero.
Thank you.